Over the Christmas New Year period, masks will be mandatory in shops, retail, Woolworths, Coles, in hospitals and aged care. On public transport, they'll be mandatory.
With the border now open to New South Wales, Queenslanders are being told to mask up once again.
We are asking this to slow the spread. This is a small price to pay for your freedoms.
The move brings Queensland into line with Victoria and South Australia, where there are mask mandates for retail, health and public transport settings. But in a state where numerous super spreader events have led to a new pandemic record, so far the government's sticking with going largely mask-free.
Our strong medical advice is that we should all still be wearing masks indoors and in places where we can't physically distance.
With daily new case numbers predicted to hit 25,000 in New South Wales within a month, experts around the world are warning against underestimating the Omicron variant.
This spreads super fast. It will be 8 times more serious in 1 week, 40 times more serious in 2 weeks, 300 or 400 times more serious in 3 weeks, over 1,000 times more serious in 4 weeks.
But Australia's Chief Health Officer has ruled out any change to the vaccine booster timeline.
We're staying with 5 months duration between the second dose and the third dose or booster dose.
So along with masks, rapid antigen test kits could be the key to our defences, helping us identify COVID cases early, even before the onset of symptoms.
If you're heading out to a big social gathering or you're about to go visit some vulnerable family members, it could be sensible to do a home rapid antigen test to give that peace of mind that you're not unknowingly carrying COVID around.
The home kits can be bought online and at chemists and supermarkets, but at $7 to $15 per test, they're not affordable for everyone. Only Victoria and the Northern Territory have programs to distribute them for free, and they're actually prohibited in WA and South Australia. So with mounting warnings about Omicron,
I have never been more concerned than I am tonight. Not just about the UK, but about the world.
could mask mandates and free rapid antigen tests give us the protection we need?
Professor Nancy Baxter is the head of the University of Melbourne's School of Population and Global Health. Professor, you're the expert. Is there a good scientific basis for not mandating masks in New South Wales right now?
Well, that's a lot of negatives there. So I would say that masks are, we know, are good protection against both giving COVID, and if they're a high-quality, well-fitting mask, it also protects the wearers against COVID. When we look at hospitals now that, doctors and nurses are wearing well-fitted, highly protective masks, they're not getting COVID anymore, despite being exposed to COVID patients all the time. So, if we had better masks and we're wearing them indoors, it would help. But the problem is a lot of this is going to be spreading or has been spreading in events, parties, things like that, where people are socially gathering and they're unlikely to be wearing masks. So there's only so much masks themselves can do unless people are wearing them.
OK, so if masks are good at preventing the spread of this new variant, as you seem to be suggesting, is not mandating them akin to basically saying, fine, no seatbelts on cars, don't worry about it?
Yeah, I don't know anywhere else in the world that has relaxed mask mandates in the face of Omicron. It doesn't make any sense at all, and most jurisdictions have been increasing mask mandates. You have Queensland that, has 20 cases today, instituting a mask mandate. As compared to New South Wales that relaxes theirs when they have their cases go from 200 to 2,000 in 10 days. So it doesn't make any sense, and it's not based on any scientific evidence, that's for sure.
Professor, some countries are giving out rapid antigen tests free of charge. Should we be doing the same thing?
Well, Canada's giving them out at the liquor store, if you can believe that. So I think that they're a useful tool. So what we have to think with any COVID, but particularly with Omicron, is we need multiple layers of protection to try to decrease the spread. This is a highly, highly transmissible virus. So, masks are one thing, rapid antigen tests are another, getting tested if you have even the slightest of symptoms. And honestly, thinking about the events you go to. There is a lot of COVID around right now, both in New South Wales and in Victoria. And I think rethinking some of the events you might be going to over the next week so that maybe you can preserve Christmas and not, have a super spreading event at your home. I think these are things people really need to start considering right now.
So, Professor, rapid antigen tests aren't as accurate as PCR tests. So are they a replacement or not?
Well, they're no guarantee. What they seem to do is be a good indicator of whether you're infectious or not, like how high your viral count is, versus whether you have Omicron or not. And certainly there have been reports from the UK of parties where everyone's been vaccinated, everyone's had a rapid antigen test, someone ended up with Omicron and gave it to a large percentage of the people at the party. So there is no guarantee, even with rapid antigen tests. It's just one more layer in that, multiple layers of protection. So not perfect, but it's better than nothing.
Now, Professor, I actually bought a bunch of those rapid tests online for $10 each, and I thought I was getting a bargain. I've been boasting about it for days, but I heard you can get them cheaper. Do you know a guy?
Well, if you go to a liquor store in Ontario, maybe you can get some for free. No, I think that they have to make them very affordable for people. So I hope that they do get them a lot cheaper for people.
Professor, I feel like we don't hear very much about washing hands anymore. Is transmission via touch not as much of a problem with Delta and Omicron?
Well, I think we're just understanding more about the virus in general and that it's airborne. So it's still important to wash your hands. I mean, that's good hygiene anyway. It prevents a lot of different viruses, so I'm not going to diminish that. But it's that deep cleaning that really didn't help the way we thought it did, that, scrubbing down your cans. We just don't think COVID spreads that way. It spreads in the air, so it's an airborne virus. So thinking about the things that prevent that, so avoiding inhaling someone else's exhaled air. That's the key. That's the key to not getting COVID. So that's both wearing a mask, so filtering out that air, opening windows and doors, or just not, being inside with these people, sticking to outside or limiting the number of people you're in contact with, particularly if you're planning something with your grandmother over Christmas. I mean, we're hoping that Omicron's milder, but it hasn't turned into the cold. Even if it is milder, it's not the common cold. It's sending people into hospital in the UK, in Denmark, in South Africa. So you don't want to give it to your grandmother. So, if there's a party you might be able to avoid this week, I would not go.
All parties are cancelled. Thank you so much for your time, Professor Nancy.
You're welcome. Ho, ho, ho.
All right, you're...